Good afternoon, Rotarians and guests. This is the Rotary Club of Toronto. I'm John Fortney, the club president, and it's my pleasure to welcome you to our meeting today. After the invocation and the recognition of traditional lands, please stay tuned for the playing of the national anthem, followed by a special tribute to Prince Philip, and then the loyal toast. At this time, I would like to acknowledge that we are on the traditional lands of many Indigenous people who have walked and cared for this land for 15,000 years. They include the Anishinaabe, the Haudenosaunee, the Huron-Wendat, and the Treaty Peoples of the Mississaugas of the Credit. Unless we think of others and do something for them, we miss one of the greatest sources of happiness that Rotarians are aware that happiness is not much in having as it is in sharing. We make a living by what we get, we make a life by what we give. Thank you. Now the national anthem. Please stand if you like.
Over to you, President John.
Thank you. As you noticed, that was in English and in Danish, as Prince Philip was also a Prince of Denmark. And we just acknowledge the passing of His Royal Highness, Prince Philip, possibly one of the greatest love stories since Queen Victoria and Prince Albert. And now the loyal toast to Her Majesty the Queen. Please be seated. Thank you, Brigitte and Glenn, again. Rotarians and guests, it's now a pleasure to introduce the head table. I am pleased to have the following people with me today. Alan Eli, a Rotarian since 1979, an honorary member and our Let's Be Personal speaker for today. Harold Hetherington, a Rotarian since 1997, former classification, public accounting. Harold is retired and is a member of the program committee and is host to our guest speaker today, with Dr. Carolyn Snider, who will be more formally introduced shortly. Ladies and gentlemen, our head table. For our virtual meetings, we do not have an official monitor to introduce visiting Rotarians and guests, so I will proceed. To our visiting Rotarians, thank you for choosing our club for your makeup, and we hope that you enjoy our meeting. To all of our guests, welcome to our virtual meeting today. Please feel free to contact the office and find out how you may be able to make a difference by joining us. Rotarians, please welcome our visitors to our club. Announcements. As you may know, but in case you do not, you should be aware that these virtual Rotary meetings, that if you have your video camera on, you may show up on the YouTube or the Google Meet recordings or live streaming. If you do not want to appear on camera, please turn off your video. We will not be able to edit you out later. Thank you. Before moving along with our agenda, you may have seen in recent emails regarding the passing of some of our former members. Past President Robert Thomas Rutherford passed away on February 25th, 2021. Bob's warm heart led to endless charitable works, including a term of president of the Rotary Club of Toronto, where he introduced Habitat for Humanity to Toronto and oversaw the launch of the Shoreborne Health Bus. Paul Harold Murphy, a former member of our club, passed away peacefully on March the 9th, 2021. As an active member of the Rotary Club of Toronto, Paul always looked forward to the Friday meetings at the Royal York Hotel and taking the children with special needs to the Rotary's annual Christmas party. And Edna Cartwright Bell, the wife of honorary member Jim Bell, passed away recently on March the 26th. She was an inner wheel member of the Rotary Club of Toronto. The inner wheel was the opportunity for women to serve before Rotary International Constitution opened up to include women joining Rotary in 1988. Our condolences go out to all of their families and friends. I would now like to call upon Sylvia Geist for a short announcement. Over to you, Sylvia.
Thank you, President John. April has been designated as Diversity Month. To honor and celebrate this period of time, the Diversity and Inclusion team members on each Friday will be expressing their thoughts about racism and the role that our club can have in advocating meaningful change. There is far more that unites us than separates us. Our commonalities outweigh our differences. Working together to confront inequality and social injustice can and will make a difference. Thank you. Back to you, President John.
Thank you, Sylvia. Very important message. Thank you. Up next, I have Emery Yurga, incoming Vice Chair of Events, for another announcement. Emery?
Thank you very much, President John. I'm here with my co-chairs of the Events Committee, Don Bell and Steve Smith. We all will be presenting our new initiative for soliciting new fundraising ideas. Next slide, please. Our committee initiates, reviews, evaluates, and implements all philanthropic, fundraising, and fellowship events. Today, our focus will be the new initiative that we are about to launch for canvassing new ideas for fundraising. Next slide, please. With this new initiative, we have 4 major goals that we would like to attain. Our first goal is we want to fundraise each year at least $50,000. Our second and third goals are, through the fundraising events, we want to activate our membership and their social network. We will also have ample amount of opportunities to reach out new potential members through these events. Our last goal is, we thought we can partner with other organizations broadly and expand our club's reach in Toronto. But again, it is important to note that our current focus is generating new ideas for achieving these goals, particularly the first goal noted here. How this can be done will be elaborated by our co-chair, Don Bell. Next slide, please.
So, during the next few weeks, starting today, we're soliciting for new ideas to organize our future fundraising. And you can provide them to us by sending us an email, or you can participate in one of our brainstorming sessions. We're going to have them in the next few weeks. Either way, we want to hear from you. We're also going to reach out to Rotaract to ask for their input for ideas that might appeal to younger people. And later on, we're going to broaden our reach to partner with other organizations. But right now, we need to generate ideas. So we're also going to strike, slide please, we're also going to strike an events working group that will be co-chaired by Steve and myself to help administer and implement some of these new ideas. Again, the focus is going to be on younger demographics as opposed to my demographics. So if you're interested in participating in this working group, please send us an email. You don't need to be part of the group to come up with a great idea. Send it along anyway, but if you want to be part of the group, please let us know. Slide.
So why join our team? Well, as past President Neil exclaimed about the Rotary Club of Toronto,
And give them an email, or even better, join their committee. Now it's time for our Let's Be Personal speaker. Over to you, Alan.
Thank you, Mr. President. What I have for you today is a saga of a 42-year journey from the Royal York Hotel to Camp Scugog. Early in 1979, a friend asked if I was interested in joining Rotary, and my answer was, "So what is Rotary?" His response, "Has the downtown community served you well?" I replied in the affirmative, to which he said simply, "It's time to put something back." On December 9th of that year, 6 of us became new Rotarians over lunch in the Imperial Room. My classification was menswear retail. I was the third generation proprietor of Ely Limited, selling fine working business clothes in an era when that was an extraordinarily important thing to do. And my sponsor told me, "Two things, Alan. Learn to say yes, and then learn to say no." Well, I got the first part. In no precise order, I chaired the classification and membership committee when the club agreed to, for the first time, fine-tune our membership so that there would be allowed more than just one banker or one barrister or one broker, and so on, you get the gist of it, to become members in our club. Led to great growth and a nice change of texture in the club. I went to Blue Mountain Camp in 1981 after a year of painting. I joined the kitchen crew and over time graduated from floor scrubbing all the way to dishwashing. 2 new camps and many years later, I'm proud to still be part of that crew in the kitchen, COVID permitting, working with kids, working for kids, singing and playing cards with friends. Great times. I was Pauline Hill's mentor when she became our first female member. I can tell you she was just an absolute gem, and she paved the way for so many valuable members of our club. For many years, I donned Santa's suit with great joy and joining into both of our Christmas events for kids and for seniors, and practiced also at about the same time. I was participating in Colin Powell's mentorship program, helping to guide challenged kids onto a better path. This club offers so many opportunities. My club has twice honored me, once with the Paul Harris Fellowship, and later by making me an honorary member of your club. I had a hoot in my most active years of giving back while making many friends, too many to name, but they remain great friends today. If you'll allow me to name but one, John Sprague. I remember him fondly and miss him often, but I can still hear him giving this advice to citywide grade 12 kids at Camp Enterprise. He said, "You can see your birth date on your birth certificate, but what can't you see?" You can imagine the variety of cheeky answers he got before he finally taught them this. It's your expiry date. During our time here together and forever, when confronted with an opportunity to pitch in, remember, you do have an expiry date. Fellow Rotarians, I leave you today with that instruction which comes and continues to serve me well, and may it do the same for you. Paul Harris sought friends and a way to help others. Mission accomplished. Thank you for hearing me out. And back to you, Mr. President.
Thank you so much, Alan. And again, always wonderful to hear our members' stories. I remember the store well. I remember I worked for a little bit across the street at Ira Berg for a while too. Thank you so much, Alan. Okay, last but certainly not least, it's time for our guest speaker introduction. And I would like to pass things over to Harold Hetherington. Over to you, Harold.
Thank you, President John. One of the closest relationships our Rotary Club has had over many years is that of its association with one of Toronto's iconic hospitals, St. Michael's. Today, we are fortunate to have as our guest speaker, Dr. Carolyn Snider, the Chief of Emergency Medicine at St. Michael's. Over the years, Carolyn has demonstrated leadership success in medicine, research, advocacy, public speaking, and teaching. One of Carolyn's notable achievements has been to raise funds for research. As a principal investigator, she led a team of employees and community members to develop, implement, and evaluate a program for youth injured by violence. She is the author of a World Health Organization report on the role of emergency medicine in recognizing and responding to violence. In addition, she has authored multiple articles and been a public speaker in emergency medicine and injury prevention. She is a member of the Canadian Royal College of Physicians and Surgeons Emergency Medicine Specialty Committee. In addition, she has degrees in business, science, medicine, and public health, and is recognized through multiple awards as a leader, teacher, researcher, and physician advocate. At this time, let's go to St. Michael's Hospital, from where today's guest speaker, Dr. Carolyn Snider, will address our club. Over to you, Carolyn.
Thank you very, very much. I am so very honored to be here today, to be speaking with, let me just get my slideshow up there, to be speaking with so many of you who are part of the Toronto Rotary Club of Toronto, who is renowned for their incredible generosity for caring for many of the vulnerable people that live in downtown Toronto and all of Toronto. I am honored to be the chief at St. Michael's Hospital Emergency Department, where we care for over 80,000 patients per year in our emergency department. We are a specialty center in trauma, in neurosurgery, in critical care, and in cardiac care, as well as many other areas. And yet we're also very much like a community hospital in the middle of a very big city. I often tell the story of my first day back at St. Michael's Hospital after 8 years living and working in Winnipeg, and the number of physicians and people that just came down to say hi again. It was great to see you, so glad you're back. I have a cousin who's had to have some specialty surgery about a year ago, and she's a farmer. She's from a very small community in Ontario and came down for her neurosurgical care. And she told me later, she felt like she walked into a small city again, or a small town, and that made her feel very comfortable. St. Michael's Hospital is like a family, and part of our family are the vulnerable patients that we see. Approximately 20% of the people that we care for each day are experiencing homelessness in our emergency department. And a big part of St. Michael's Hospital Emergency Department has always been the Rotary Club of Toronto's Transition Center. Now I'm going to tell you about what we normally use the Rotary Club for, the Rotary Club Transition Center. We just call it Rotary in our emergency department. But prior to COVID, and then I'm going to talk about how we've adapted and how important it remains in our space. The Rotary is a place where, after we finish the urgent part of our medical care in the emergency department, patients who are experiencing homelessness or vulnerably housed are able to come and get a bite to eat. They can do their laundry. They have a moment to sit, watch TV while their laundry is being done. At times they might have been in our sleep rooms and have a sleep. They have an opportunity to refill some of the basic needs that many people don't remember, or often those of us that are much more privileged don't realize can be in such short supply and needed in one's purse or backpack. More and very importantly are the people that are there. We have people like Jenny Snow, who's there on the left. Jenny is one of our community support workers who's Indigenous and provides Indigenous care to many of our patients, both through Rotary, but also in the emergency department as well. And on the right is Carson. Carson's one of our social workers. We actually have 3 social workers regularly and often many more helping out in our emergency department. And as you can imagine, our community support workers and our social workers have been extremely busy during COVID. And yes, last year, this time, COVID arrived. And our life in the emergency department, just like all of your lives, have been changed immensely and will be forever changed. I now treat patients with a mask and with a face shield. When I go in to see a patient, I'm wearing a yellow gown. I am harder to hear, but I can tell you, I can see smiles behind the masks, and that's always important to remember that we're still there and we're still caring for patients in the same way. When people come into our emergency department, they are met now by a screener. Typically, these are RPNs, or registered practical nurses, who will check the vitals and will ask about some of the risk factors for COVID. Patients are then seen by our triage nurse and registered into our system. And based on any number of factors, they are then sent to one of our various areas in our emergency department. Even when there isn't a room right away, we have set up spaces for people to wait that are protected with plexiglass. People wait at different times in more distanced areas, along with places that people can sit next door to each other of their family. And yet, during the first wave in COVID, we didn't have a place for people to stay once they were finished and yet had nowhere to go. We didn't have a space in Rotary that was properly distanced for people to sleep. And so we transitioned it to more of a hub. And all of our community support workers now work much more out in the department and use that Rotary Center right now as a hub. We do look forward to the day to being back in where we welcome those experiencing homelessness in that space more regularly. We are fortunate now with faster turnaround times of COVID swabs to be able to bring some patients in for meals and getting their laundry done and quick brief visits as well, as long as we can ensure everybody's masked and safe. This photo is actually from last spring. At one point, when the turnaround times for swabs were so long and we didn't have places in the city for patients who are experiencing homelessness to stay isolated, we actually had them in our emergency department at St. Michael's Hospital. At any one time, we could have as high as 30 people in different spaces separated out, and at times people stayed for 4 or 5 days. As you can imagine, our community support workers and social workers were working well over time. And indeed, we staffed up significantly in those areas. Fortunately, through great partnership and advocacy with groups like the Inner City Health Associates, the Shelter System in the City of Toronto, Toronto Public Health, and in the Ontario health tables, and many of the hospitals around, we were able finally to open up places that are referred to as the recovery isolation sites. And so when somebody who's living in a shelter or experiencing homelessness and not actually sheltered has signs or symptoms of COVID or has COVID, we actually have them tested at our CAC, our COVID assessment center across the street from our emergency department. And then they get onto a special bus that has been specially set up for isolation, and they then go to one of these isolation recovery sites. I know all of us are excited about the vaccine because it works, and it is going to be the only way we get through to the end of this. And yet the waves are tough and they're concerning. In the first wave, as many of you know, we saw most of the people that were experiencing COVID in the long-term care facilities and other conjugate settings like the shelter systems. And it was absolutely devastating. I have no doubt many of you listening today were affected personally by COVID. And if not, frankly, we all know that it was probably a certain amount of luck. In the second wave, we saw COVID more prevalent in the community and in younger people at that time. And the only way we were able to manage COVID at that time was through some increased capacity in our hospitals. We have continued to grow capacity in our hospitals, and yet we have started to reach in the third wave the issue of capacity being around human healthcare worker power. We are doing our best to mitigate everything we can do. And indeed, it is probably that human power, person power that I suspect is why we've had to ramp down surgeries in the last week. In this third wave, we are seeing so many essential workers, so many younger people who are essential workers. They're the people that are keeping our food plants open and our warehouses and distribution facilities for those of us that have moved to ordering things online. It's the education workers. It's the people working in our grocery stores and pharmacies that we have to be so very careful to protect and vaccinate early in order for us to see that light at the end of the tunnel. And we need to keep the indoors safe. We need to close them when they're not safe, even though we've got to get them ready and back up as soon as possible. And frankly, we also need to keep our outdoors safe, but as a place that we can be healthy physically and through mental health and our emotions. I mentioned that the third wave is bad. Yesterday, they've just announced, as we were starting this session today, that they had over 4,200 cases in Ontario yesterday, which was the highest number so far in this pandemic, second highest, I'm sorry, in this pandemic. I have absolutely no doubt that we have coming that number that will have the highest day soon. 70% of the cases in in Toronto right now are due to variants of concern. Patients are sicker, they're more likely to need hospitalization. They are younger, as I mentioned earlier. They are 2 times more likely to need ICU care and 1.5 times more likely to die from COVID. And so right now we are in a state of major crisis in our hospitals. And as I mentioned, right now we're worried most about the healthcare capacity for having people to actually deliver the healthcare. But I can tell you what, we are doing things. As I mentioned, the vaccines are a huge portion, and we're trying to target to get the vaccines to the people where it is most likely to be affected, who are most likely to be affected by COVID, and to be in spaces where they're most likely to transmit it. We are, from a hospital care capacity standpoint, having to transfer patients from ICUs further out, and indeed where it used to be regional, we're now looking provincial. We've had to ramp down non-essential surgeries, which is just devastating for so many, so that we can redeploy those people that work in that to help those in the more acute settings. We are looking at how we can ensure that people have had conversations prior to coming to hospital or while in hospital around their goals of care with their family physicians and with our physicians, so that we make sure that we treat people as they wish in those early times of devastating illness. But it's not easy, and it is hard to be on here and be hopeful in these darker times. And yet I can say that this vaccine rollout over the last few weeks has provided me great excitement. We are delivering more vaccine this week than we have in weeks. And while it's taken much longer than many of us have hoped, it is quite positive for us. We also are starting to talk about things that we're going to do in our hospital when coronavirus is less impactful on our day-to-day basis. And so I wanted to also tell you about some of the things we're doing now to change to care for those most affected by homelessness. This is the prints for our upcoming ambulatory care. Now it's detailed, it's changing, learn more and more about isolation needs and care for our patient population. But on the bottom left area here is our Rotary Center, and it's going to be there, and we've got lots of space just like we did before, because as I mentioned earlier, 20% of our population are experiencing homelessness. And so we have the ability now to think about how do we do that safely with the right distancing in place, because it has been an essential part of how we deliver care in St. Michael's Hospital. We've also taken our program of community support workers and expanded it through a donor-funded program called the Emergency Department Outreach Program, and we're working with the Ontario Health teams and a collaborative of many downtown community colleagues, including Street Health, which runs the Sherbourne Health Bus, and many of our colleagues in family health, in mental health, in addiction, and in shelters, to ensure that our community support workers don't just don't just work in the emergency department, but actually are connectors to all of these programs that are incredible and essential in caring for those experiencing homelessness. What's been amazing for me are the people that do these jobs in our community support workers and outreach workers. They are some of the most adaptable, incredibly resourceful people. And so we're trying to build our capacity with them so that we can continue to support our most vulnerable patient population. I covered a lot today because there's a lot going on. When I was asked to do this talk, well, I think it was almost 2 years ago now, it was really to focus on people experiencing homelessness and how much we rely on the Rotary Center and the Rotary Transition Center in our emergency department, and some of the ideas. Obviously, COVID is everywhere for us, all of us that are here today. And so I wanted to bring in some of our experiences and how we are actually managing to maintain our mission to care for those who are most vulnerable. I do think that I am looking forward to our conversation and questions, and hope that we can delve into some of the key questions you have now. So I'm going to stop sharing, and over to you, President John.
Well, thank you so much, Dr. Snider. We knew that your talk it was going to be a heavy talk and a hard talk because we're all living it and no one more than you. It's amazing, even though most of us have been very involved with the Rotary Center at St. Michael's, it's still a hard number to believe that 20% of emergency is homeless. That's a big number, and has its own special field of work that comes with it. I think rather than a hospital doesn't have that kind of clientele. When the Rotary Center, is it now used in other urban hospitals, or is this a rather unique to St. Michael's, or have others picked up this idea?
It is my understanding that we're the only one in Toronto with a center like this. There are definitely other hospitals that have forms of like community support workers working in their emergency department. I can think that UHN does have some community support workers, but by no means the numbers we have, and no means the resource that we have through the Rotary Center for sure. And when Harold mentioned the violence intervention program that I started, that was in Winnipeg. At that time, it was specific to people who were affected by violence, but we didn't have a physical space, and that was has been a really essential part of St. Michael's ability to meet its mission.
I mean, well, it's nice to know that the work that we're doing is so relevant, and it'd be great the day when we don't need to,
Yes.
get housed. And I do have one question that's going to be a little difficult to answer, I think.
Okay.
There are reports that healthcare workers in hospitals and long-term care facilities are refusing vaccines. Is this true, or is this allowed, or can you comment on it?
Yeah, I think there's a few different responses to that. The very first one is that we are currently not able to force people to get vaccines. That would be something that would be at a much like a government level, constitutional level, that they would have to do that. But what we can do is continue to educate and continue to try and understand why there might be healthcare workers who aren't getting vaccinated. I can tell you that at St. Michael's Hospital, 100% of the emergency physicians who do work here are vaccinated, that are able to be vaccinated. And as far as the number in terms of our nurses and other healthcare workers in our emerge are also at very, very high percentage numbers that are vaccinated. I think that a big part of that has been around ensuring that the education is about what vaccines, why they're so important, and whether there are side effects and what those risks are. Is a key part to that. I can't be clear as a physician that the first vaccine is the right vaccine. The risks that are being discussed are far, far lower, in my view, than the risks of fatality, hospitalization, and ICU. I have yet to see personally as an emergency physician, anyone in our emergency department with a side effect due to a vaccine that couldn't have been dealt with potentially at a family practice or a walk-in clinic. It is incredibly important to get vaccinated. So I understand the concerns when people hear these. The one caveat I want to say is that sometimes we're given these percentages, but our denominator is very, very hard to determine. And so at one point, I knew that 100% of the emerge docs that are working in our emergency department right now are vaccinated. And yet the number looked lower, and I wanted to know why. So I finally asked, what is that denominator? And there are many people who might be listed in that denominator who are people whose primary place of work is a different hospital. And so they weren't listed as positive as having been vaccinated at our hospital. Or some of the people were retired, but they still have privileges because they had in the past come back to help out or to do some academic work, etc. So again, the numbers are really hard to interpret in terms of the percentage. And I think that's really important in some of the nursing care denominators. I know our nurse leads have struggled a little bit with those percentages as well. What we can keep doing is getting onto the floor, asking if people want to talk about vaccines, and we've been doing that, and I think that's been very successful.
Excellent. Here's an interesting question. Since COVID, has the percentage of homeless patients increased?
Yes, I think that especially was the case in the first wave. Many people who were very precariously housed, is a term that we often use. They may have been couch surfing or living rough in spaces that initially they were able to manage, were essentially forced to being fully homeless without shelter over on a nightly basis. And so that was especially concerning. There definitely has been some increased space over the last 6 months. The city did try to rehouse some of the people who are homeless into some more permanent housing. And that is actually probably the best answer for all of this. And if we can get to that root space and ensure that the housing is appropriate and we can do it and we do it well and sensitively, that's probably where we're going to go. I was talking to somebody who does do some of the housing relocation from encampments. And they said initially we were sort of saying, we've got an apartment for you over there and you over here. And what we forgot to engage in is that for many people, this is their community. And so once they started to reapproach this by saying, we have 5 apartments and we've gone to a group of 5 people who've been living together in a tented area, and you guys are all friends and buddies and you are each other's support system. That's where they started to have success. And where we often forget in policy and initiatives like this are to actually go to the people most affected and to say, what do we need to do to help you? And what do you see as the problem and how are we going to get there? And that's where we've seen the most success long before COVID and especially during COVID.
That could not be truer. That in Rotary and all the work we do, one of the best things, especially if you're going abroad or something, is what do the people you're helping, what do they want? How are they going to be best affected and best? Yeah, so true. I have another question here, but I don't understand what the letters are. So do you think the new OHT structure will help to tackle the recovery phase after pandemic? It was also new when the pandemic hit last year. I don't know what OHT is.
I'm happy to explain that too. So thanks for that question. The Ontario Health Team is called the OAT or the OHT. So there was essentially a restructuring literally days before we were hit with the first cases in Toronto and in Ontario, of first cases of COVID. And the sense is that we've taken larger geographies to work together. I do believe that in the downtown East Toronto area, the OAT that we're a part of will greatly allow us to be better at recovery. And so that we're already seeing that through work like the program that I'm leading around ED outreach workers. We're working so closely with the many, many different organizations. I think what I like about the OAT is that it's, at least in the downtown East Toronto area, is that it's acknowledging the many community agencies as part of healthcare. The housing is an essential part of healthcare. We can't be healthy if we don't have a safe space to lay our head each day. We can't be healthy if we don't have places to eat or ways to eat. And so I'm appreciative of what the OAT has brought our department in terms of the connections and collaborations.
That's amazing. It could not be truer. I have a question about staff. All of us sort of think we know how horrible it is for all of you working in the field, but we probably haven't even got a slight imagine of how bad it really is. Is there emotional support, or do you guys at the hospitals, do they have people to give support to the staff that just must be going through hell?
Yeah. So as a leader, that has been an incredibly important part of my role, is to ensure that we're cared for in the midst of trying to care for others. And we all are aware of burnout being a really significant issue long before COVID as well. For me, yes, we have lots of resources, and yet they can be hard to see the need for in the moment. And so we really try to preemptively approach that. As a leader, I knew that we felt so out of control in the early days, all of us, like everybody in the world felt out of control when COVID hit, that my job was to ensure each person who wanted to had a piece of control. And so we have, as the leader of the physicians, we have approximately 32 full-time physicians in the emergency department. And about 28 of them took on a specific lead role. Some it was the simulation, sometimes it was a co-lead role, simulations of protected resuscitations. We had others who were our liaison to the protection, and so the IPAC is what we call it. So those that were looking at PPE. We had others who actually have debrief training that we typically use after a hard case, a bad trauma, any of those kinds of things, that essentially became the person that would check in after any time somebody had intubated a patient, had seen somebody die from COVID, all of that. And so they automatically started that process, and that was an interdisciplinary group of people. It was incredible how many people stood up in small moments and in big moments in our group. And I really think that helped our wellness, because we all like to have a certain amount of knowing that we're moving forward together with this. But it's been a long year and we're exhausted, absolutely exhausted.
And his topic will be money laundering in British Columbia and across Canada. How did we get here and what can be done? Please feel free to invite guests and share the links to connect. However, have them connect with the office in order to be admitted to the meeting. This spring, like I said last week, and everyone's getting positive and excited, but we have to stay home. Everyone's got to look after everyone else. And our part, as Dr. Snider said, is to stay home, follow the rules, and we have to get through to the end of this. And everyone, please be safe, enjoy as much as you can, get some fresh air and exercise. And thank you so much for coming to the meeting today. Today's meeting is adjourned. Thank you.
Thank you, Mr. President.